Hey, I'm Quincy and I'm a radio personality, but just like you, I'm always wanting to make better health choices for myself and of course for my family. Now that's why I've teamed up with my friend Dr. Dean Tindall and the fine folks of New Life Naturopathic, the creators of new-life weightloss.com, to bring you a podcast focused on giving you the information you need to make the best health decisions for you and your family. Now, that's going to be without sway from what mainstream medicine has become. Now, this podcast, Pursuit of New Life, we're going to release one each Friday. And we're going to focus on debunking the mainstream medicine myths now associated with naturopathic, holistic medicine, while giving you clear insight into ways you can make your health a lifestyle and not a jump from fad diet to fad diet. Experts in the fields of biochemistry, chiropractic, physiology, women's health, and much more will weigh in on a range of topics, all designed to open your eyes, expand your knowledge, and bring you to new life. Now be sure to subscribe to Pursuit of New Life on all the podcast platforms, and also follow us on YouTube at newlifenaturopathic.com, and be joining us every Friday for Pursuit of New Life.
Hello and welcome into Pursuit of New Life with the New Life Naturopathic and Holistic team again with us here as we make our way through this journey of trying to share information with you that is going to be beneficial in both your health journey and just, trying to figure out ways that the medical system is telling you the wrong things about how to approach this all. We've got Dr. Dean Tindall, Dr. Julie Stuber, we've got Miriam and myself, and we are going to approach what is health because that's a pretty key thing, right, Dr. Tindall? We got to figure out what health is if we're going to try to achieve it, right?
Absolutely. And most people have it completely wrong definition.
Well, so we are going to start out with right straight from the book of what the definition is, and being the noun that it is, the condition of being sound in body, mind, or spirit, especially freedom from physical dis-ease or disease or pain. We'll talk about that in a moment. The general condition of the body is another way that it's used. And then a condition in which someone or someone is thriving or doing well. And I'm sure that we're going to get into some conversations of how that means function. I know that we're going to get into that discussion as well. So, Dr. Tindall, as we have now defined health in a way and put it right here in front of folks, for the people watching on YouTube, those listening via podcast, of course, heard the definition. What are some things you can kind of break down for us that tells us a little bit more about this dis-ease and why we kind of give that enunciation to it?
Okay. Well, basically with a lot of people and what we have in our current healthcare system, we don't actually have a healthcare system. We have a disease care system. We all wait until we're sick. We all wait until we have all our problems. And then we want to go to a doctor, and especially nowadays, a medical doctor, and intervene. It's very costly. It's very expensive. And what happens is it's just not a system that works. And so what we're trying to teach patients and people to do is start taking responsibility for your care, start taking responsibility for yourself. And then what happens is that you can actually help regulate where you're at on what we call the health spectrum. So when we were back in chiropractic college, and this kind of goes with the general philosophy of the difference between medical doctors and like chiropractic, naturopathic, and the actual healthcare field versus the sick care field. So we were always taught that there's a health spectrum. You have health, dis-ease, disease, and then death. And what happens is throughout the day, and this is at every moment, every time of the day, you're on the spectrum moving back and forth like a little wave. And so what happens is being healthy, it's not taking drugs. Being healthy is a person who's healthy is a person who's not taking medications, is not having symptoms, is functionally fine. They don't have pain. They're going along good. Their physiology is doing like it's supposed to. They're not having symptoms. They're able to have a long life and good health. It's just like, kind of analogies of a lot of people, the car. We want to make sure that our car is driving in tip-top shape, and we manage and maintain our car. We put the right kind of gas, put the oil, rotate the tires. Why? Because we want that car to last. We want the most out of the life of that car, and because it's a big investment. Well, guess what? Our health is a huge investment. It's the most important thing that we have, because we don't have your health, you have nothing else. You can have $1 billion, and And if you don't have your health, what good is $1 billion?
Yeah, that's right.
So
I like the analogy you made, though, about the before, as we were getting ready for this episode, you were making the analogy about the check engine light. And there are some of us that'll let that check engine light sit on and ding at us. And there's others that take care of that problem as soon as it comes up. So kind of talk about that for a second and what that means in this health spectrum for the YouTube viewers that are looking at it. And for those that are listening without the visual of this, there's health, there's dis-ease, then there's disease, and then there's death. So give us a kind of an idea of this this check engine light and what that means in this health spectrum to help us understand this a little bit better.
Okay. So let's say if I want to be healthy, I want to eat, I want to make sure I'm managing my stress, I'm sleeping, I'm exercising, I'm staying active, I'm having good mental thoughts. I'm eating, like I said, in those doing just general activities on consciously on activities of being healthy. So for example, if I'm eating a carrot or celery or a good piece of meat or a good steak or fish or chicken or really good healthy food, and we call single ingredient foods, and there's a reason, and we'll get into that later. But what happens is that promotes health. If I'm eating a donut or pancakes or biscuits and gravy, that moves me towards the dis-ease side of the realm. And the reason being that those types of foods, quote unquote foods, bring nothing into the system, because the purpose of eating is to extract nutrition, and that nutrition is from that food. So if I eat, like say a steak, I'm going to bring in B complex vitamins, I'm going to bring in proteins, I'm going to bring in different connective tissue, I'm going to bring in enzymes, I'm going to bring in a whole bunch of different things that my body can reutilize to make and repair myself. If I eat my vegetables and fruits, I'm going to have vitamins, minerals, enzymes, and things that are in food that we don't even know anything about that's going to create health, right?
Yeah.
But if I eat a donut, which is basically sugar, flour, and nasty oil, I get nothing from that donut, but I have to process all that sugar, that fat, and all that nastiness, which then steals nutrition from my body to be able to run right. So that starts to put me in a disease state. I'm starting to I'm doing activities that's creating disease. And how does that show up? Lots of times it shows up with people as I'm starting to gain weight, or I'm starting to feel tired.
So this is the check engine light starting to blink a little bit and come and show up for us.
Yeah. And what happens is our check engine light starts to come on and we're like, oh, it'll go away. And you keep doing the same activities. And then what happens is then you get bad enough. And then what happens now, you're in a full-fledged disease state. I got diabetes, I got heart disease, I got all this other stuff going on with me. I'm way overweight. And then what happens, I'm going to run to my medical doctor. Again, the worst person in the world to go to for health. They're awesome when it comes to emergency medicine. They're going to save your life, your broken bones, all that other stuff. They do a fabulous job. But when it comes to actual health, they're clueless, because you don't get healthy by giving drugs. Because the drug itself, if you ever listen to a radio ad, the drug itself, this is what the drug does. And in the last 30 seconds of the commercial is how the drug is going to make you worse. Watch out, all these symptoms, death, and your dog's going to run away and your car is going to blow up if you take this drug. And so, so that's pushing you further towards that death state, maybe a little slower. So, and then again, if you listen to the commercials, maybe even a little bit faster.
Yeah.
And so our goal is, as far as like what we do, naturopathic, chiropractic, acupuncture, all these different things that we do out here, yoga, meditation, all these things, these are activities that moves us back to the health state. So what we're trying to do with people is try to educate. And when you're in the disease state, that's where we come in. And that's where we're not going to let you try to get to that full disease state before we intervene. What we want to do is say, and that's why we use symptom surveys, functional assessments, brain stress indicators, toxic questionnaires, all these things to get to know you and get your current level of health is. We also do like with our office, we look in like big survey on like what kind of food you eat, because that's, guess what, back to I always say 80% of people's health issues is created by what they're eating. So what we're trying to do is get to know a person, what's going on with them, and then use that information to focus in on like what organ systems becoming dysfunctional and what we need to do because again, we don't want you to get to that full down here. We want you to start, okay, we're heading this way. Hey, let's do lifestyle dietary changes. Let's do, targeted whole food supplements, some herbs, and then talk about sleep, and all these other things to kind of let's move you back towards the health thing. And then once we kind of get you to the health thing, we want to develop lifestyle modifications so that we stay in that health range.
Well, and one of the ways that we discover that is some of the labs. And Miriam, as we've talked in previous episodes, the difference in how labs are done through New Life Holistic Services and others like naturopathic services. Tell us, maybe contrast what you're looking for and what your team is looking for in a lab, as opposed to what some of these healthcare system or hero doctor system is looking for when they get into looking at labs.
Oh, yeah. Hi. Sorry, I thought Dr. Tindall wanted to talk about that. Yeah, so as far as our labs go, I think I touched on this in the last podcast, but we have a holistic approach of developing kind of like a system and a way of testing disease state, and basically catching any diseases or symptoms before they get full-fledged. And I guess, yeah, thank you for pulling that back up. So disease, I guess you can kind of look at more of a discomfort. That's kind of another way to kind of analyze your own symptoms. We are trying to avoid getting you to the disease step, whereas a lot of medical doctors, you go to them, you are already at the disease state, you just don't know it. And that's why you have so much discomfort and, as it says, dis-ease with yourself, and you're trying to explain to the doctor, why am I having all these symptoms? And they're telling you that your tests are normal. Your blood tests are coming back within normal range. Well, their normal range is basically the disease state. Yeah, you've already gotten there, and you are on your way to, unfortunately, the death state. What we are trying to do is keep you from developing those diseases, and a lot of that is prevention. The drugs out there are not preventing these diseases; they are only masking the symptoms. I'm sure the majority of people that are even taking these drugs already know that. The problem is they don't have access to a lot of the types of services that we provide, and that's where we come in, and that's what we're here for, is to promote and educate and hopefully make people understand this is how the system is set up, and there is another way. And I also like Dr. Tindall's reference to I think the fire station, where if your house is being burned flames, that's where the medical doctors come in. They're kind of like the firefighters. They put out the fire. But to rebuild the house and the foundation, and to prevent the house from falling apart, too badly, that's where we come in. And so that's kind of another good way to look at it. And we are still working on how to make getting access to these lab tests convenient and easy. We're developing and implementing more at-home test kits, which will be available on our website, and we will definitely talk more in detail about all those different types of tests. But point is, the medical doctors are great for basically knowing what types of diseases there are, they are not good at preventing these diseases from happening. And so again, that's where we come into play. Um, and my definition of health is the combination of the physical, mental, and of course, psychological aspects of your well-being. And the lack of discomfort and a good quality lifestyle. That's how I see health. And if you are not living that way, something is wrong. Something needs to be fixed,
Yeah.
and not just masked, but fixed from the ground up, from the roots.
Well, we're going to have Dr. Stuber talk a little bit to what is health and function versus symptoms. But before I switch to that, what I'm hearing is there's a philosophical difference, and I know Dr. Tindall's going to speak to this some. There's a philosophical difference between the way you, as naturopathic holistic services, look at a lab to help prevent, and a doctor, a medical doctor, looking at it and saying, oh, you're normal. So where, other than this podcast and information on this website, where does someone even figure out, okay, how do I know that this person is telling me the right numbers from this lab I just got done? I mean, what can people expect, or how can they go about it better?
So I think a good thing to remember is just the background that holistic healthcare providers come from, and that is the approach and the ability to interpret things from different perspectives and kind of put them all together rather than just kind of look at what's in front of them. So be able to decipher between many different results based on a lot of research. I mean, if you look on PubMed, there is more research on, for example, curcumin than there is on statins. About 20,000 more research articles and publications. And so a lot of the misinterpretation of naturopathic health is, as I mentioned before, when I switched from being pre-med and going into more naturopathic routes, I was called a witch doctor. And so for whatever reason, now modern medicine is called the mainstream, whereas naturopathic medicine is the original medicine. It's basically healing your body from the roots and fixing all these problems before they turn into bigger problems.
Right.
And that's the main thing that you have to understand is that's not how modern medicine sees it. And so I would say there's a lot of different ways to interpret lab tests and lab results. And I mean, Dr. Tindall has more than 30 years of experience, and he has 2 master's degrees, and he is very well educated, not just through schooling, but his own experience. And all of his patients have seen real results, and a lot of them have come in from years of trying to manage some of these diseases or cancers or ailments, and they come in to Dr. Tindall's office, and he's able to fix them within a few days or weeks for a few bucks versus a few thousands of bucks.
Yeah,
So
that is a good way to put that. Yeah. And so, Dr. Stuber, as we come into talking a little bit more about what is health, I mean, that's how we started this episode, is talking about what is health. We went to a very textbook definition, but I'd love for you to give your perspective on function versus symptoms and what is health.
Okay. health, very simply, is about how your body works. It's not about symptoms. It's about you on the inside. So I can use a few examples. Right now, people seem to be, oh, I have the cold, oh, I have the flu, oh, I've got COVID, and they're having all these symptoms. So they think something's wrong with their body. And in reality, when the immune system kicks in, you have symptoms, you're perfectly healthy. Then there are times you have no symptoms. For example, cancer, the big one. Usually when you start to have symptoms, it's progressed. So what we do, how we are so different than most other medical doctors, a lot of other even naturopathic offices, natural therapies, is that we have a lot of different types of diagnostic tests. We have hair analysis, we have DNA testing, we have saliva testing, we have finger stick kits, at-home kits. I mean, I can go on and on. We can do different types, combine them. But the real difference is that we listen and that we care and that we educate. Like I'm going to backtrack a little bit when you said, well, where do I go? How do I know? My standard, what I tell people, if you don't see it and you don't understand it, don't believe it. I have people that will come and they say can't even pronounce what's wrong with them. And I'm like, well, what is it? I don't know. The doctor just told me. I'm like, no. If you don't understand it. So at the core of health is you have to understand yourself. You have to understand what your goals are. Where am I at? Like where we move from, okay, we're just managing this disease. You're going to have it forever, but we're going to control it. We're going to eradicate it, and you're going to not have that disease because your body's going to function properly. And by looking, like Dr. Tindall said, at the questionnaire we have is pages and pages. We sit down, we review it, and we sit down with you and review it. And in our office, you always get a report of findings. An individualized.
And you educate along with these findings, and you're not trying to, like Miriam said, mask it. You're trying to have them understand a lifestyle shift in health.
Absolutely. Our goal is to get all the organ systems working properly. Just like if I go back to the car. It's just like if you only you got to fill the gas tank, you got to keep the oil clean, I don't even know everything you got to do for a car, but I know I take it to the place and they do everything they're supposed to do, air, I don't even know. I better just stop right there. So
I was going to say that's not helping your metaphor of understanding, but cars are different. Go ahead.
I was going to say carburetor, and I don't even think we have carburetors anymore. So, but everything has to work in sync. You can't just fix one thing. So at the core of what we do is to focus on how your body is functioning, the whole thing. Take the individual pieces, but they have to connect together just like a puzzle. And that's why we are educated. That's what we learned. That's why I chose to be a doctor, was to solve the problems, to listen to people, to help them, to put the puzzle pieces together, and then to teach them so that they have the power to take control of their health. And then I hear a lot of times, like, I treated more women than men, and I'll hear, oh, I just feel different. The doctor says it's nothing. I'm like, well, no, you have to listen to your body. So the big thing is education, and we make ourselves available to explain things to you. Like, it's not always about you feel, it's about how are things working.
So let's go back to this health spectrum for a second and what you're talking about, function versus dysfunction. So I put it back up for our YouTube viewers, and we have on the green side, health. Then we go kind of closer to the yellow, dis-ease, and then disease gets over into the more yellow-orange, and then death, red. So when you're talking about function, dysfunction, give us maybe some perspective in relation to this health spectrum of how people start to maybe feel that check engine line start coming on, because you didn't get really a chance to comment on this graphic.
Okay, well, generally what happens, at least what I've experienced in 25 years, is people just start to feel differently. They start to react differently. They notice changes and like, I just don't sleep very good. Or, again, with women, a lot of times, gosh, I just been craving this. I just wanted this or want that. There's indicators that are, if they, usually by the time people are aware of them, we've gotten into the disease and the disease state. And what happens is when the body is healthy, you learn to listen to that little voice, those little tiny symptoms. Like it can be something as your nails change, your hair's different. That just you smell things different. You learn to pay attention, listen to that little voice, and so you stop it. You stay healthy. You don't have to progress and constantly backtrack. Every time, especially as we get older, our body changes, but every time you move towards disease, it takes more energy to get it back to health.
That's good. Well, that is a good perspective. And we're also going to talk now with Dr. Tindall about the philosophical difference. And we've kind of been going throughout this episode, the philosophical difference of how, as naturopathic holistic services, look at these labs and some of these issues, as opposed to how medical doctors look at them. So Dr. Tindall, as we wrap up this episode, can you kind of give us, car analogy or not, whichever way you want to do that, of how this philosophical difference can be understood a little bit better, so as listeners and as people that aren't in this profession know better how we can go about fixing these problems and getting closer to health than we are disease.
Yeah. Okay. Well, actually, I love Julie's inability to use the car analogy on fix it. And the point, and what I mean by that is this: she doesn't fix her car; she takes it to somebody who knows what they're doing with it. Does that make sense?
Make that point.
That's and that's what we do. And then as far as those labs go, it's years of education. I've been going to school for a lot of years, and I've read hundreds of books, thousands of research articles. And what you have, for example, the labs. You have because the labs are averages. So as people have gotten sicker and sicker, those averages have gotten wider and wider. Does that make sense?
Yeah.
So there's optimal numbers, and those numbers that we learn, those optimal numbers are from years of experience and lots of research, reading, education, all that things. You're not going to find them at Dr. Google. And again, that's why people get messed up, because they think one symptom's caused by one problem. Well, that's not the case. One symptom can be caused by multiple different problems. So that's where the symptom surveys, the questionnaires, all that stuff comes in. And back to that kind of philosophical difference, what the philosophical difference, and I even see this when I see medical doctors or nurse practitioners try to get into the healthcare, like trying to do natural health type stuff. They still bring their philosophy with them. And their philosophy is if I give you high doses of vitamins, or I give you more of these things, and because they take the supplements, they still act like they're drugs. And they're not drugs. We call them supplements. That's why we use whole food supplements. The purpose isn't to give the body a whole bunch of stuff. So what it is to understand what's this. Take the symptoms, information that we gather from the labs and everything, as much information as we can, and put that together to develop a working kind of nutritional diagnosis to say, this is how we get you back to health. Whereas, again, the doctors are like, okay, we're going to do is manage your health. We're going to manage your disease state. We're not going to get you better, because nobody, like with us, we have our dietary program now online, is we market it as a weight loss program, but it's really a get healthy program: healthy food, healthy body, healthy weight. Your body will naturally find that healthy weight when you're doing healthy things. And the reason most people don't deal with it is because nobody wants to change their lifestyle dietary habits. They're afraid to do that, and fear creates a lot of issues, a lot of problems. And Miriam said something. I was going to say something. You can either, and what she said, you can either live this way, or the other option of that is, or you can even die this way. Mm-hmm. So if you want to eat the donuts and the stuff, you're moving yourself towards that disease state, and you're going to die that way. I've told patients, I've been doing this for a long time, and I've told patients, hey, you need to change your lifestyle dietary habits, or you're going to be dead soon. And I had one guy that I want my biscuits and gravy. I said, that's okay. You can have your biscuits and gravy, but please take this piece of advice. Buy good insurance so you take care of your wife because you're going to die soon. It's sad to say, but guess what? He didn't listen. I know it sounds funny, but I actually have a death talk with patients. I said, look, here's where you're at.
Yeah.
And if you don't change this, you're that is, because you got to remember on that spectrum, we don't get people at the disease state. We get them on the death's door state, because they've gone through the medical doctors, they've gone through this, they've done Dr. Google, they've done everything, they've tried to sell. They bring, people bring in boxes of supplements because they're trying to do it themselves. They're wasting time, money, energy, and like Julie said, when you get so sick, it takes a lot of time, effort, and energy to get back. And when you keep doing the wrong things, you keep driving yourself this way and this way. And our goal is to get people going back to this direction. And it's, for us, it's frustrating because I would love to work on patients who are just in the disease state, like the dis-ease state, like, oh man, I'm not feeling good, doc. I get some, but the vast majority of the ones we get, they're in the red zone, and we don't have much time. We got to do some, significant things to get them straightened out, to get them back out of that realm. And what's fascinating is the ones who listen, most of them, get better. And, are we going to take out everybody that we get and get them completely, like you're going to live forever? No, like, we've have patients like pancreatic cancer. Had a lady, we added an extra 3 years to her life. We have a patient who has COPD. He was supposed to be dead in 6 weeks. We added another 7 years to his life, and they're quality years. And just, it's frustrating, and again, just like, for example, here the other day, I know we got to get wrapping up, but this is a kind of an interesting case. The other day, I had a patient come in chiropractic on Wednesday. Can't breathe, hunched over, and I'm like, "What's wrong with you?" He goes, "Oh, I got this fungal infection in my lungs." He said, "Oh, I have this disease," and I said, "Oh, I can't remember off the top of my head right now." But he goes, "I got this disease." I go, "Oh, yeah, it's a fungal infection." He goes, "Oh, my sinuses, and I constantly run into my lungs, and I feel terrible." And I go, "Well, how long have you been doing that?" He goes, "I don't know. It's been probably 15, 20 years. And I go, "Okay, what are you doing?" And he was like, "Well, I've been seeing the doctors, and I got a pulmonary doctor, and blah, blah, blah." And it goes on this whole history. And I'm like, "Oh, okay." So I said, "Well, that's just, it's a fungal infection." I said, Mayo Clinic did a study several years ago, 93% of all upper respiratory ear, the T-zone, is fungal infections. So I said, I showed him some breathing exercises, and it's on our website. That Miriam does it on the website. It's called pursed breathing. So it's to help build up your lungs and capacity of your lungs. Doesn't cost you any money. And then I put him on a simple protocol to start rebuilding his lungs and stuff like that. And then the other thing that we got him was a product called Seagate nasal spray. So he comes back in Monday, and he was like, he goes, "Doc, what?" I go, "What?" "Oh," I said, "Cool." He goes, "Yeah." He goes, "This is the best I felt in ages." And I go, and I said, "So how much money did you spend with the medical profession trying to?" He goes, "Untold amount of money." I said, "And for $12, we're able to clear your sinuses up."
Well, that's why we want people to go to newlifenaturopathic.com for this very reason. There's a lot of information there. Also, speaking of, you were talking about the time and the change, the lifestyle change. You mentioned the other website, and that's newlifeweightloss.com with a dash between new and life.
Yeah.
And the reason that we want people to go to that one, and like you kind of talked about why it's called weight loss, but it's to shift into lifestyle. And that's why you have this 12-week challenge at the website. So I give people kind of an idea briefly, because I know we have to wrap this one up, of why this 12-week and why that would be something that would get them on the right path.
It's the reason we do the 12-week is because most people, what we're trying to do, the first month we tell you what to eat. The second month we start giving you choices. So what we're trying to do is train you to take control of your life and start managing your life. So making conscious changes in your life. So because change is going to occur. I don't care what you want, don't want change. People, I don't need change. Guess what? It happens. So either you take control of the change and you make yourself healthy, or you let change keep happening, and guess what? You're back in that death zone. So what we're trying to do with this 12-week challenge is, first month we teach you what to eat and tell you what to eat. Why? Because we're trying to get you under control. And in the meantime, we're trying to teach you to make a grocery list. So you get in the habit of making a grocery list. The second month, you get choices between foods. Now we're trying to get you to make food choices. We keep it simple. You get these 2 meals. Check choice. We have 4 different programs, but each program has, like on the 5th week, you get choice between meals. Why? We want to make it simple, but we want you to also start to make decisions like, okay, now I got to do meal planning. So we have a meal planner that you can download and do that. We got a shopping list that you can download and you can check off the stuff that you need. So what we're trying to do is teach you and educate you. I developed my meal plan. I got my shopping list. And then when I get home, I eat all those foods. So it saves you tons of money. The reason being, you're going to buy the foods that you're going to eat. So they're not going to go to waste. They're not going to sit in cans in your cabinet or your refrigerator until they go bad. And so then the 3rd month, you're getting choices between even more meals. Again, so we're trying to teach you is take control of your life, make those choices. And the other thing that makes our program very unique is we're trying to teach people, this is a long-term lifestyle dietary modifications. And so what we're trying to teach people is that you can eat healthy. You don't have to eat a bunch of salads and cottage cheese, and you don't have to go out there and suffer and basically punish yourself to try to lose weight. What we're trying to teach people is you can eat healthy food, good food, steak, fish, chicken, all this other stuff, all your vegetables, your fruits. And what we're trying to do is teach you that you can eat these foods, healthy foods, and tasty meals that you, your family, husbands, wives, kids will eat and like. And that makes it so you can stay on this program. And so what we do with every one of the recipes is we put them through a nutritional calculator. We get them balanced out. There's a lot of science behind it. People don't need to know that part of it. But there's a lot of science and there's a lot of technical stuff behind that. It's 30 years of my work. It's a lot of, Miriam, big input, Dr. Stuber, big input, and that's what we're trying to do. And these meals we make. So like this weekend, we're going to be posting here pretty soon, sweet potato waffle, because people are asking us, more breakfast things. It was delicious, wasn't it, Julie?
Yes, it really was.
It sounds very delicious.
It is, and so we take these. What's that?
Kept you full all day, right?
Yep. Yes, it did. Actually, it did. I would say, because and then kind of back to myself, and we talk about health. I used to be very unhealthy. That's why I got into this thing. I'm 58 now, and Dr. Stuber will attest to this. My work day, I get up at 6:30 every morning, and my work day, like Miriam and I were out we were working on some of the podcasts and some of the website and stuff last night to about 11:30, Miriam?
Yeah, at least.
Yeah. So that's after I did my chiropractic for the day, did my house calls with patients, and then went home, ate, took care of some animals, and then came back into the office and we worked until 11:30. And I do that 7 days a week. I usually go for 3 or 4 months being able to do that. And I usually anywhere from a 12 to 14 hour day. And I'm remodeling 2 houses myself. I take care of horses, my practice, house calls, I run down the Amish, I do all this stuff. And when I tell patients, if at 58, I can do this and have the lifestyle that I have, the busyness that I have, and the people that I take care of, you can do it too.
Yeah.
So
well,
anyhow,
that is a good mic drop to end on right there. Is that if Dr. Tindall, the other thing is, I love that we have Dr. Tindall and we don't have to worry about Dr. Google either. So we've got we got the rest of that. But we do want to remind you that newlifeweightloss.com is a great resource to start this 12-week challenge, to start your direction, your journey to a life change that will truly change your life. And it's new-lifeweightloss.com. And then there's also all the labs that we're talking about and all the other parts of the practice is newlifeNaturopathic.com. And those will be in the description and everything on your podcast. And we would love for you to share the podcast with your friends, follow Pursuit of New Life on all the different podcast places, and also on YouTube, where we're going to have this video available as well that have the graphics and things like that for those that want to watch. We are moving our way through this journey, looking forward to learning more, because I'm learning right with you, the listener. This wonderful team from New Life Naturopathic and Holistic Services, Dr. Dean Tindall, Dr. Julie Stewart, and Miss Miriam. We're the only ones without the DR in front of our names, so we just do the one name thing like the Brazilian soccer players. So thank you, folks, for listening and being part of this journey with us of pursuit of new life.
Thank you very much, Quincy.